already. And wow, to see how many people today's meeting, I'm so happy because I know that you are investing your time to be in this meeting today. Thank you for coming here. So far, we have about almost 50, I guess, right? Yeah. Okay. I believe you are coming for something, expecting something from this meeting. And I believe that you are coming also from various cities in Indonesia. And even we have some guests from the Netherlands. Welcome, Bas. Welcome to this meeting. From Faculty of Geoinformatics, Science and Earth Observation, or ITC, University of Twente, Netherlands. I also would like to greet the team for the NEDtalk meeting. Halo Pak Hertanto, Mas Lena, Mbak Ilham, and every one of you. I also would like to kindly greet all participants here for joining us here, and there will be some other participant from the ITC will joining us soon. So I think we also have some students from UP University, Indonesia University of Education. Hello everyone, thank you for joining us here, and from many institutions and agencies. Okay, I hope everyone is safe and well right now, even though we are still meeting online like this. Thank you, and I hope at the end of the meeting you will get valuable insight to bring with you. So I want first to introduce what is NEDtalk. NEDtalk is initiated by the alumni group of Novik Refresher course in Manado in 2011, and it started just a few months ago and coordinated by Pak Hartanto, the founder from BPPT. Yeah, the idea of NEDtalk is making a self-refresher course and sharing knowledge. And in NEDtalk, we discuss various topics related to special world. The speaker of NEDtalk comes from various agencies and universities, including from ITC, University of Twente, Netherlands. And NEDtalk is held every Friday from 1:30 p.m. to 3:30 p.m. through Zoom. So far, we have already 6 NEDtalk meetings, and for you who were not able to join our previous meetings, you can watch the recording in NEDtalk YouTube channel. And for those who want to know more about NEDtalk, you can go to NEDtalk FB page, and the YouTube and FB page link will be posted in the chat later. So during this meeting, I will tell you small technical things about the meeting. So the meeting will be divided into 2 parts. So the first part will be the presentation from Mbak Ilham, and the second part will be the question and answer session. So I kindly invite all of you to mute during the presentation. You can still post the question using the chat, and you can also raise your hand after the presentation to ask directly, and you can post your question either in Bahasa or in English, don't worry. So since we have interesting topic today, I invite you to actively participate in the discussion. So for today's presenter, we have Mbak Ilham Dia Saleh. Hello Mbak Ilham, how are you? Yeah, Mbak Ilham will present the presentation today. So currently, Mbak Ilham is a lecturer in Department of Architecture Education, School of Technology and Vocational Education, Indonesia University of Education, UPI, Bandung. And she holds a Bachelor in Architecture degree from ITB, Bandung. And she holds also 2 master degrees from Master of Engineering in ITB and Master of Science in Urban Planning and Management from ITC University Twente, Netherlands. And she recently pursued her Doctor of Philosophy PhD in Urban and Regional Planning from the State University of New York at Buffalo, United States. So her field of expertise or research interest is in urban planning, urban housing, GIS, quantitative research, and education planning and policy analysis, and vocational educational and architecture. So, Ilham will present her studies regarding exploration of the spatial pattern of COVID-19 confirmed in urban areas Bandung, West Java using GIS and using the least square regression analysis and ArcGIS. So it's an interesting topic for me, and I think you also agree with me, and I don't want you to wait too long. So I am inviting Mbak Ilham to present her presentation. So Mbak Ilham, the floor is yours.
Very much, Mbak Winida. Oh my God, it's good to be here. It's good to see so many lovely faces this afternoon. I would like to deliver my talk this afternoon. Hopefully it will run smoothly. Fingers crossed. Please allow me to share screen, and I would like to see whether you can see my screen properly. Can everybody see it now?
I think it's still going. Yeah, I can see it right now. Perfect.
Okay. Thank you very much for the opportunity. Mbak Widada, thank you very much for the introduction part. So without further ado, I would like to start doing my presentation today. So like Mbak Winida mentioned earlier, it's pertinent to COVID-19 pandemic, and I'm going to use GIS spatial analysis to study the spatial pattern of COVID-19 cases in Bandung, West Java, Indonesia. But Winida already mentioned about my educational background and a little bit of my expertise. But here I would like to deliver the talk in much more informal way. I mean, this is an ongoing project, or this is an ongoing research work. So the aim of this presentation will be getting your constructive feedback or discussion pertinent to what I presented in this particular talk this afternoon. So feel free in the discussion session, we can talk and discuss about that. So the structure of my presentation, I would like to start with the introduction. I would also like to introduce a little bit about the method which I use, the exploratory analysis process, the preliminary result, and the discussion. So as a start, I would like to begin with showing the video of the number of cases in provinces in Indonesia. The reason why I do this is I would like to show the severity of COVID-19 problem nationwide in Indonesia and how West Java is among other provinces in Indonesia. So basically, the top #1 province who has the highest number of confirmed cases is Jakarta, our capital. And recently, East Java became the second, and then West Java, where my study area is, become the 4th place throughout Indonesia. So, but we maintain the case for less than 3,000 cases, and hopefully the number will not rise as we move forward. So, this is Indonesia. And West Java is located just next to our capital, Jakarta, and Bandung is the capital of West Java. In the introductory part, I would like to explain that I began this research, this ongoing research, by simple reasons. The first, as individual, I would like to keep myself abreast and vigilant about the current COVID-19 pandemic situation in Indonesia, in my province, and also in the city. The second is, due to COVID-19 pandemic, all of schools are closed, including all universities in Indonesia. And we have to do work from home. Students have to do school from home. For students who are particularly in their final year, they are shifted from getting the primary data collection, shifted into try to get the secondary data collection. And for students who are in my class, actually the applied statistics class, I try to introduce the secondary data sources as the source of their statistical analysis input. So as a lecturer, I would like to exemplify the utilization of publicly available secondary data to conduct research for my students. And the third background is as a researcher. Well, I have to work from home, and as a researcher, I have to do research even though I'm home. So basically, this is a work on progress I'm currently doing using the publicly available data, and I'm examining the spatial pattern of COVID-19 confirmed cases in Bandung, West Java. And I would like to explore the possible explanatory variables that can explain the spatial variation of COVID-19 cases in Bandung, West Java. So basically, this ongoing research project is derived or motivated by those reasons. So the data sources are coming from the Picobar, Jabar Province, and then also from the Pusikov, Bandung.go.id. So basically, those governmental institutions are generous enough to publish their data on their website, and people can retrieve the data from their website. In their website, they visualize the data, like the cumulative data or the daily new confirmed cases, and we can follow their updates every day, and we can also try to project that ourselves if we retrieve the data. So basically, they give the data, cumulative data or the daily confirmed cases, and they give a link. Like we can access their CSV file, their Excel file, or we can also download the API public data. So those are the sources of data that we can, where we can retrieve the data. So basically, we can download the CSV, and we can also download the Excel file. They're also generous enough to give the files pertinent to individual cases of COVID-19 confirmed cases, patient under supervision, and also the people under supervision. But then, after retrieving the data cannot be used directly. We have to do some data cleaning process, some data curation process before we can visualize that. For the data visualization, for the researcher, maybe we can capture the data, retrieve the data, and do this visualization ourselves. But we can do more from that. We can do descriptive data analysis, maybe the tabular data analysis in Excel or in SPSS, or we can do spatial data analysis in the ArcGIS platform. Or we can move forward, like take it to the next level, maybe creating a model or develop a regression model, interpolating based on data, and do forecasting for further, forecast of what's going to happen in the future. I would like to start by explaining about the data visualization. As I mentioned, we can do the tabular data visualization, but we can also do spatial data visualization. So the spatial data visualization is something that we are specifically interested as a GIS analyst or researcher who has background in GIS analysis. We can do the cross-sectional data visualization, which is like capturing at a certain point of time what is the number of cases for each regencies in our province. So this is West Java, and we can get the number of confirmed cases for each district. And we can see for West Java, we have two epicentrum of where highest confirmed cases happen. The first is the district neighboring the capital, and the capital is the capital of West Java, which is Bandung and the surrounding area. But we can also do the time series. So basically, this is what I did the first time when the COVID-19 hit, and I tried to record the data and do some visualization, and did some visualization. And this is not the current data, but hopefully that will help to show that the tabular data that we have can be taken to the next level to show how the spread of COVID-19 happening over time throughout the district of West Java. So here we can see over time, we can see the number of confirmed cases developed, and we can see for certain areas near the capital or in the capital of West Java itself, the number keeps increasing and increasing, and showing the dark red color. It means that more people are getting infected over there. So that is the example of the data visualization using the time series. And this spatial data analysis has been used by West Java provincial government to do some multi-criteria analysis to help them decide which district could be open, or which district could have the partial quarantine, or which district can start to ease down the quarantine level. So I got this data from Instagram of our governor, Ridwan Kamil, and it shows where are the areas which have the highest level of emergency or a state level of awareness about the COVID-19. So Bandung, the capital, is among the areas which has the 5 level status, and followed by other areas in West Java. Most area in West Java are in the mid-level, and some considered as having lower risk. So it's visualized as green. So based on those multi-criteria spatial analysis performed by the government, they decide which district can be open, or which district can ease down their quarantine level, or which district should be more aware of the current situation. But Bandung is still considered as a 0 level in terms of COVID-19 awareness level. So that's why I'll try to present about the data in Bandung. As we can see here, how Bandung placed among other provinces in West Java. So we hopefully maintain the rate of infection for around 40 people per day. I hope this number is not increased because of our premature new normal implementation. I do hope so. And this is the distribution of confirmed cases along across the sub-districts in Bandung. So the Pusikov visualized the data using the dot, the size of the dot, on top of the density. So we can see that the area where the population density is high, we can see higher dots. And we will examine that using our regression analysis, whether this observation is true or not. So this is how I try to visualize the data. This is the data I came across in 15th of April, and now the number of cases is increasing, but I try to visualize the spatial distribution among the sub-districts of Bandung. And this is also how I try to visualize the distribution, like time series distribution of the cases in Bandung. So we can see the first sub-district who got confirmed cases is Cicendo in the western part of Bandung. But then the number of adjacent sub-districts increased over time as well. And we can see other part of sub-districts in Bandung become more red, having the shade of reddish color throughout. I map also the patient under supervision, and later I also map the people under supervision. So basically, this helps us to understand the spatial distribution and the severity of this problem. And as an individual, it also informed me where to roam in my city. So basically, as a person, I only roam in my sub-district and neighboring sub-district, because I know that in my sub-district, which is the lowest level of density in Bandung, Indonesia, we have lower number of cases. So after seeing the data visualization, me as a researcher think that, well, this is interesting. I'll take it to the next level. I'll try to see how the spatial distribution, not only in the sub-district, but in kelurahan level. So it's a kelurahan is maybe neighborhood, or in the case of each. So we have 151 neighborhoods in Bandung, and based on the confirmed cases in 17, we can see the spatial distribution. Still, the western part of Bandung area is having the higher number of infection, and this is the spatial visualization of how many patients under supervision. Slightly different because we have higher number right in the middle of the city, not in the center. This is the center, but we have somewhere near maybe Antapani or Archamanik. Those are the neighborhood which is the majority of the land use are housing, our residential area. So now we are getting more serious. After getting the data, like my curiosity as a researcher is become intrigued. So I'll say, well, shall I do the spatial data analysis, like hotspot analysis or cluster analysis, or shall I do the regression analysis to find possible explanatory variables that explain the variability of number of cases in Bandung? That's why I try. So I explore some methods which are suitable to analyze such a phenomenon, which are hotspots analysis and cluster analysis. And then it will be followed by the exploratory regression analysis, the least square regression, and geo-weighted regression. I will explain in more details about what are those methods doing and what result we might expect from those methods. So hotspots analysis basically try to find which area has the high number of cases, surrounded by high number of cases as well. It's called hotspot, and it gives us also the number of the percentage of the level of confidence. the statistical level of confidence. So running the hotspot analysis in kecamatan level or sub-district level, we found out that we have hotspots in the western part of Bandung, namely in Cicendo, Andir, and Sukajadi, which we know that those areas like Cicendo is the first sub-district which get the infection, and it contaminates the neighboring sub-districts. If we delve more details in kelurahan level, we can see that there are also hotspots in those areas, but we can also having the low or the cold spot in the eastern part of Bandung. So basically, I live in the eastern part of Bandung. So knowing that the eastern part of Bandung is the cold spot in terms of number of cases, that would give me like a reassurance that, okay, if I want to go around my neighborhood, I should go to this sub-district or this kelurahan instead of other kelurahan because the number is significantly lower, or it is considered as hotspot or cold spot. So I never go to the hotspot area for the sake of my own safety and my family's safety. So as an individual, at least that's the reason why I do this analysis. For the cluster analysis, we try to map the cluster of high surrounded by high, or high surrounded by low outlier, or low surrounded by low. So for the western part, we have the high number surrounded by high number. So it is located in the Cicendo, in Andir, and also in Sukajadi. For the high number surrounded by low outlier, we have it near Kiara Condong, Antapani, and also Arcamanik, which are the residential neighborhood. And for the low cluster, we came across that the eastern part of Bandung has the low cluster, which is like Kecamatan Gedebage, Kecamatan Rancasari, dan Kecamatan Panyilekan. So this, like the detail of the result, and it gives several warning about the variable. The statistical data analysis, we can do the correlation analysis. I taught my students, like, we exercise to do the correlation analysis of sub-district nearby each other. Do they have the high correlation number? If they have the high correlation number, means if one sub-district has higher number, the neighboring sub-district also higher number. So it is maybe called like spatial autocorrelation in terms of geography or GIS analysis. But again, I did some exploratory regression analysis because I have no idea yet in the first place which variable is significantly affecting the dependent variable. So we tried to do the exploratory regression analysis first to come up with certain explanatory variables. And after getting the significant explanatory variables from the exploratory regression, I did least square regression analysis and take it to the next level, geographically weighted regression. I will explain it to you later on. So one of the explanatory variable is the vulnerable age group, as we know that senior citizen or senior people above 64 are the ones who are prone to get or contracted the virus. So these are possible explanatory variable that I included in the analysis. The next one is also the vulnerable age group, the ones above 70 years old. And another explanatory variable is population density, because in our previous data visualization, we can see big dots on top of the higher density visualization map came from Pusikov. So these are the explanatory variable, and I ran the regression analysis. Well, the regression analysis, we can do it using SPSS or we can do it in Excel. But luckily in ArcGIS, ArcGIS spatial analysis utility also provided us with the regression analysis functionality. So we can do the regression and we can also see the result of the regression spatially. ArcGIS spit out the result. The R squared means that our model fit how many percent, our model can explain how many percent of the variability, and adjusted R squared. So as I mentioned, this is an exploratory process. So I punch in a variable, or I punch in a second variable or the third variable, and I run the regression analysis and see which model fits better, which model can explain the variability better. So this is an ongoing process. So maybe all of you can help me also to maybe pinpoint other explanatory variable that might explain the variability of our confirmed cases in Indonesia. So what next? I'm still doing exploratory analysis, like gathering more data. I have an assistant. Like, luckily, one of my colleagues seen what I posted on my social media, and I think she's here, Ibu Beta Paramita. She embraced me to join her research project. So this is part of her research project now. Like, come up with the significant explanatory variables that explain the variability of confirmed cases. So elaborate recommendation in what to do in densely populated urban areas in Bandung, especially those areas highlighted as a result of our spatial analysis earlier. That's the more stringent discipline or physical distancing or social distancing are needed in those densely populated areas. Do we have more campaign on hygiene way of living? Do we have to pose a partial quarantine to slow down the local transmission rate? Or what is the new normal in the densely populated neighborhood? So we incorporate more variable in urban setting about the climate, about the temperature, to complement the analysis which has been done earlier. So basically the GIS spatial analysis is, we see it from above, but we can also after doing that, we have to delve in more details in the neighborhood level. As an urban researcher, what should we do to eliminate this problem, to ensure the livelihood of inhabitants in urban densely populated area? So these are the visualization of the sub-district which I mentioned earlier, how densely populated they are, just nearby the airport and also the train station. So we discussed why Cicendo is the first sub-district getting the virus, why the number of cases are higher and constantly higher as time goes by. So this is an ongoing discussion. And also Kecamatan Sukajadi is next to Cicendo. Kecamatan Andir is also next to Cicendo. But I'm more concerned about Kecamatan Andir because it is more dense. It's denser than Kecamatan Cicendo. Why? Because I live there. I live there throughout my my undergraduate year. So it's very dense. It's an urban slum. So as a researcher and as an individual, I I can experience how to live in that densely populated area. And as a researcher now, I'm thinking of how I can contribute to like eradicate the local transmission or the spread of COVID-19 in densely populated area. So I have my heart with Kecamatan Andir. Kecamatan Bandung Kulon is next to Kecamatan Andir. So, what is the takeaway from this analysis? I would consider this as an input for further research process by incorporating more variables like population, urban physical settings, built environment aspect, and those related to urban setting. Maybe Bu Beta can help me about explaining more variables pertinent to urban setting, urban physical setting, urban climate, etc. And practically, the preliminary result can also inform policymakers to formulate strategies to prevent inhabitants from contracting the virus or slow the local transmission of COVID-19 in densely populated urban areas. This is to ensure the safe and healthy livelihood of inhabitants in densely populated urban villages in Bandung. Well, I believe that's the end of my presentation, that's the end of my talk, but it doesn't mean that our meeting ended right now. I really need your constructive comments, concerns, feedback, and critics to this exploratory work on progress. I would really appreciate it, and we can do it in our discussion session. Thank you very much. Mbak Windy dah. Thank you, Al.
Thank you, well, Mbak Ilham. That's such a nice presentation, I may say. And I may say, I can see that the distribution of confirmed cases in Bandung is have a certain pattern, as you say, that there are, you can maybe using the analysis of hotspot or something. And you also, through your presentation, you also still ongoing process in looking for other possible explanatory variables. Well, I'm inviting all the audience here to post their question, comments, or input for Mbak Ilham regarding her presentation in our topic right now. It's a very prominent topic right now about COVID-19, especially in the area of Bandung. While we are waiting for the questions from the audience here, I just want to ask. Because you work so fast on your presentation regarding the table that you get from the portal, COVID-19 public portal. I'm curious, what are other variables that they have besides the location? Do they have the name as well, or maybe age? Yeah, I don't think they have name because it's a very personal information. But besides the location, the age, what are other variables that they have in their data?
Yeah, I will try to go back to the slides where what kind of data provided in the website. This is the data, like the raw data retrieved from the website.
So you have location,
We have the ID of the patient, the location,
the district, sub-district,
kelurahan, and what?
Okay.
The age, we have
gender, and the date of confirmation of the cases, and that's all.
Yeah, that's all they provided. In terms of the longitude and latitude, it is not representing where they are residing. So basically, that's the center of the kelurahan. So we cannot track. So this is private data. So we cannot track the location of the patient. So the kelurahan is the lowest level of analysis, even though the data is provided from the single person. So we can also have the age, the gender, whether they are a patient under supervision or whether they are positive, confirmed cases, or whether they are ODP.
So you have gender here. Have you tried to explore the gender variable?
Yeah, I haven't taken a close look about the gender variable, but I examined the data visualization from the website. It is more likely that male contracted the virus. Maybe because they are more active going outside, or they're still working, or those kind of things. They're still roaming around the city for for the livelihood to make the ends meet.
Breadwinner.
More percentage of male are getting the virus, like confirmed cases, and surprisingly, those are with the productive age group. So in my variable earlier, we are concerned about the senior citizen or as vulnerable population. It turns out that the productive age group, male, have more likely to contract the virus. In Bandung case, I don't know about other cases in Jakarta or in Surabaya. Maybe similar thing. So, thank you very much for the input. Like I come across, okay, I should take a look at the distribution based on gender and see maybe I can perform the t-test analysis whether there is significant difference of male contracting the virus against or versus the female. Thank you, Mawinida.
You're the most welcome. So we have one comment from Mbak Tutin Arianti.
Yeah.
So
She's my colleague. She's my boss.
Okay. Oh, hello, Bu Tutin. Welcome. So Bu Tutin.
Yeah, sorry, I don't turn on my video and so there are lots of noises behind me.
Okay.
So, would you please just read my question? Thank you, Mbak Winida.
I will. Thank you. You're welcome, but Bu Tutin. So I will read her comment here. So Bu Tutin said that such a rigorous research, Mbak Ilham. Congratulations. Thank you for sharing your ongoing research with us. Do you think it would be helpful to see also inhabitants' education and economic backgrounds? I think these two factors are most influential in the pandemic spread. How do you answer to this question? Ilham, please.
Yes, that will be interesting. Those variables are interesting, but using this publicly available data, I don't think that variable is like attached to this information. So we need to get more data pertinent to the social economic status and also the education level, because this is not provided. But I don't know whether this variable can be a proxy, like the pendapatan per kapita per kelurahan. What is pendapatan per kapita yang
Income per capita.
Income per capita level for each sub-district can be a proxy for measuring the relationship between the social education level with the likelihood of getting the virus. That will be an interesting exploration, by the way. Interesting research avenue to pursue. Thank you very much, Ibu Tutin. I really appreciate that.
Yeah. So you got some input already. Nice.
That's the aim of this presentation, right?
Yeah. So we have also another comment. So I still inviting all of you, participants here, audience. Please post your comments, your input, your question. It will be very nice to hear from you. So I'm reading from Mariana Hanafia. Is she also your college? Oh no, I think she's from Medical Sriwijaya University. Hello from Surabaya is in Sumatra, right?
Yeah, in Palembang.
Nice. Welcome. So I'm Mariana from Faculty of Medical Sriwijaya University. It's so interesting. So my question is, can we trace the initial location of one of the cases, then which direction to spread, and what background can cause the spread of the virus? My question is, can we trace the initial that's the repetition. So that's the question. Can we trace the initial location of one cases, and then which direction of spreading the virus?
Thank you. That's a very good question, I would say. We can trace the first case because the data is showing the confirmation phase in each kelurahan. So basically, in the first case found in Bandung is in Cicendo, and we can see from which kelurahan it is located.
Maybe you can show also. I think you have shown it.
Yeah.
Maybe you can also show it again to us.
Yeah. So basically, Cicendo is the first district, first confirmed cases in Bandung, and the neighboring sub-district start to catch up in terms of the number of cases. From this, we can see that not all kelurahan in Cicendo having the high number. So we can see whether from this kelurahan or other kelurahan in Cicendo are the first confirmed cases. We can go back to see from the data, the tabular data we get from Picobar. So in terms of in terms of tracking down to which direction the spread, I just read the publication published by BIG, Badan Informasi Geospasial. I attended their webinar like 2 weeks ago. They have the spatial analysis, the GIS spatial analysis, showing the direction of the spread, whether it's going to the western part or going to the eastern part, and even the number of, the severity of the spread. But I'm afraid that I have to read in more details about their method. I believe that their method is conducted in ArcGIS as well. But I'm afraid I have to tell you now that I'm not really up to that method yet. I still need to read thoroughly in terms of their method. After I acquire the skill to run the method, then I think I can do it in this particular research. So thank you very much. Tadi Mbak siapa? Mau ini dah?
From where is it? So it's from Mariana Hanafia from Faculty of Medical, Sriwijaya University.
Thank you very much, Ibu Mariana.
Yeah.
Yes.
Thank you very much. Pertanyaannya sangat bagus dan membantu saya untuk lebih kritis lagi melihat, dan bagus sekali. Thank you.
Yes.
Yeah, I'm still inviting all of you guys. You can raise also your hand. I will invite you to speak up. If Bu Mariana, if you still have any other question, you still welcome to post question. Do you want to ask further to Mbak Ilham?
No, that's enough.
Okay, that's answer your question already.
Okay, thank you.
Thank you. Seems like Pak Jarod raised hand.
Okay, okay. Yeah, before Pak Jarod, I will I will raise the question from Novi. I think I know Novi. Novi, I think she's from ITC as well, and she's a PhD candidate as well. Hi Novi, do you want to tell your question directly, or should I read your message here? Your question, please. You can ask your question directly.
Perhaps you can read it.
Oh yeah, okay, I will read it. Okay, I will, of course. So I am Novi. I have question. Is it possible most of the person who infected by the virus because most of them use public transport? You know, Bandung is the home of angkot, of public transportation. People is so familiar and very possible to use this angkot to any places in Bandung. If I see from your data, most of the person who get infected is from outside of the city center, such as Kiara Condong, etc. So please, Mbak Ilham.
Yeah, thank you very much, Novi. It's a very keen observation relating it to public transport. So, I have a discussion with Ibu Beta Paramita pertaining to public transport role in terms of the confirmed cases. It is interesting that Cicendo is the sub-district where the public transportation has many stations. Like first we have the train station located in Cicendo. The second we have Hussein Sastranegara Airport, which is also located in Cicendo. So we thought that maybe, not maybe, the first case in Bandung brought from outside Bandung through train station or through the airport. So next level, maybe the local transmission could happen in public transport like angkot. Like this is blessing in disguise. We do not have like mass public transport system like in New York City. In New York City, most people contracting the virus most people contracting the virus because they use the public transport system. They use the subway. As we know, in New York City, subway system is very busy, very crowded, and also not very hygienic. But in Bandung, we do not have such underground transport system. We have busway, we have angkot. Oh, what is angkot in Indonesia? In bahasa Indonesia. So maybe that. But getting the data of the utilization of public transport and relating it to this particular research is a bit tricky. But I will try to delve in more details about that. Next week, I'm gonna participate in Masyarakat Transportasi Indonesia webinar, where they are concerned about the public transport system and how public transport system play role in terms of COVID-19 spread, or how public transport system can eliminate the local transmission of COVID-19. So thank you very much for
because you know in angkot it is possible you sit one another without distance, so perhaps it can be caused.
Very true. I will raise that question in the Masyarakat Transportasi Indonesia webinar next week. Thank you very much.
Thank you, Mbak Ilham. Thank you, Mbak Novi. I hope it answered your question. Yeah. So I will go to Bapak Jarod. Bapak Jarod, please. You have raised your hand, so I will give the floor to you to ask directly to Mbak Ilham, please.
Okay, thank you for the opportunity, Mbak Winida. So, Mbak Ilham, thank you for the great presentation about Bandung case. So, first of all, probably I would like to give a suggestion on how to visualize the the COVID case in the Bandung area. Probably you should consider to make a ratio between the positive case with the number of population, or what we call prevalence value. So it could give a better view on how much COVID-19 case in one area, because every area has different population or different population density. So for instance, 10 positive COVID case could be could become smaller in a high population area, but 10 COVID case in a small population area is very big case in one area. So that probably could give a better picture on the maps that show which area have more bigger higher COVID case to visualize. So that's number one. That's got to be for your considering. So, and the second part is for the exploratory analysis. So I also agree with what Mbak Novi mentioned earlier. So we should consider the transportation, because the nature of this COVID-19 case is transmitted by people's mobility. So like it or not, we should consider that. So what I'm suggesting is we could also add the physical locations, such as the potential crowd locations, such as markets, transportation hubs, like that, or plaza or something like that. Especially nowadays, people start applying the new normal. Supermarket, the supermarket is start to open. That could be the new cluster or something. And also related to the if we cannot get the transportation route, we can also use the road density to make which area have more road density. That makes the area is more connected each other. So that could give the high potential to be transmitted by the COVID. So yeah, that's for the exploratory analysis. And hopefully, if we can get the mobility data, we can get the answer from the Sriwijaya University, which also asked the spreading and or the origin of the COVID case. So Google has already published their mobility, and Apple also published their mobility, and Facebook also. Well, Mbak Winida a few weeks ago also talks about the provider mobility. Well, hopefully we can get all the data to understand the behavior of the spreading of the COVID case. Yeah, I think that's all for me from me, Mbak Winida and Mbak Ilham. Thank you.
Thank you so much. That's such a nice input and comment, right, Mbak Ilham? So do you want to respond to this, please, Mbak Ilham?
Yeah, I'd like to respond to the input from Mas Jarod Samadi. That's why I like this kind of discussion or sharing session, because you can see what I cannot see. So I really appreciate the feedback pertinent to visualize the confirmed number relative to the number of population, or relative to the population density, that will highlight in more details about the severity of the problem in relation to the population or current population. Thank you very much for that input, number one.
Yeah, basically, because this is what the Netherlands did to visualize their case. So yeah, that's why I tried to compare it with them.
Okay, thank you very much. I will delve into more details how Holland visualized their infection number or confirmed cases number. Thank you very much for highlighting that particular topic. For the second part, Mas Jarod also suggests that we can like map the location of places where most people gather, or places where most people have a crowd. So like supermarket or traditional market. As we know that when we read our recent news update, that traditional market is also one of the clusters of the COVID-19 infection. That is doable. Definitely that is doable. Thank you very much for the input. We'll try to incorporate the location of the public places and also maybe the size of those public spaces, because maybe we have smaller market, we have smaller traditional market, but we have also like pasar induk Gede Bage, pasar induk Caringin. Those are catering or serving more people throughout the city. That's interesting. For the third input, pertinent to try to find the road density, which area has higher density. That will be also interesting, but let me see whether I can elaborate in more details about the road network data and see the hierarchy and find the density of the road network. I believe that one of my friends did that in ITC, so I can try to interview him how he did that and try to teach me how I should do that. Thank you very much.
I say something?
Yes, of course. Is that Jorian or? Yeah.
Thank you very much
Yes,
for
please,
your
Jorian. Yeah.
thank you for your presentation. As you might see, I'm really live in ITC at the moment. For the first time in 3 months, I'm here preparing graduation gifts, because in a couple of weeks the next batch will graduate. So I combined, that's why I was tuned in a little bit later, because I wasn't allowed in the building before 8:30. But I'm here, I'm in the restaurant, I just had a coffee, so it really feels good. Thank you for your amazing presentation. It's a hot topic. As we can see, we had even over 80 participants in this session. So to you, a lot of respect. It was really interesting. Maybe some of you are following the news here in the Netherlands, and as of this week, the measurements for the COVID is getting looser. We were in the so-called intelligent lockdown. Ivan is missing the coffee. Well, the coffee isn't that good. But slowly we're getting out of the lockdown, and people are slowly allowed to do a little bit more, though they are calculating how many people I can infect, for example, and if that number stays under the 1, the measurements will keep on getting wider and wider, though if the virus will go up again, they will of course start locking down stuff again. So slowly public life is starting, cafes are opening, the building here is opening. So yeah, I hope for you guys as well this will happen in some time, because it's nice to be at home, but it's even nicer to be among your friends, your colleagues, and your everyone around you, because we need it. And so I think your presentation really hit the spot at the current situation. So well done. And I will show the coffee machine in a bit. So thank you.
Thank you, Jorian. So for those who are missing ITC, ETC, and also the coffee machine, Jorian is showing the machine right now. Yeah, thank you, Jorian. Wow, is it still working after a few months?
It's still working.
Okay,
I
nice.
don't have my card.
Oh, you don't have your card anymore. Wait, and I woke. You will know this as well.
Go get my card.
Oh, that's really
Wow.
nice. Missing that place so much.
Summer already, yeah?
Oh,
It's summer. It's really. Wait.
yeah. So for those who are not knowing, ITC is in Enschede, and it is in the campus in Enschede. So this is the garden in the middle of the building, right, Jerian?
Yes, the
Yeah, yeah. People are usually gathering here and enjoy the scenery and also the air. Nice.
building. Look, we even have some students working hard here.
Ah.
Hi,
Alumni from Indonesia.
greeting from Indonesia.
Hi.
We still have students working here. So, all right, that's a short tour of the building.
Thank you. I can see the
Thank you.
Indonesian corner there. Behind you is Indonesian corner over there.
Over there.
There's always there
So
Indonesian.
Indonesian students are usually gathering over there.
Yes.
Okay, so maybe I wasn't part of the group then. Okay, thank you, Jerian, for the short tour and also the comment. Mbak Ilham, is there anything that you want to respond from Jerian?
Thank you very much, Yurian. You bring back good old memories. The coffee machine. Like I always take the coffee from the third floor, and I really looking forward to coffee break time. And the restaurant is among the favorite places we had in Enschede, where Indonesian students met. Indonesian corner. Yay! Thank you, Yurian.
Okay, then I will go to. I think I saw someone raise or make a sign. There is Pahar Kanto could help me who raised.
Reno Tiara.
Yeah. So I'm inviting Reno Tiara. Please, you can you can ask any other question to Mbak Ilham, please.
Thank you for the presentation. My name is Reno from Educational University of Indonesia. I want to ask something. Well, I see that the number of infected people still increasing, but we know that we will do the new normal. So if on the next semester we study normally with the new normal and the new health protocol, we follow the health protocol. So is there any possibility if the number of infected people will increasing again significantly? I mean, if we go back to normal life. Thank you.
Thank you very much, Reno. Reno is one of my diligent students. She always pay attention to my lecture. So whenever I stumble when I explain something, I look to her and find some new motivation how to proceed. So thank you very much, Reno Tiara. I really miss you in campus. So I was in campus this morning. I know that how students miss campus, how students interact with other students in campus. Yeah, we will soon implement the new normal life. Like still we have to consider the health safety protocol. But next semester, I believe that we're still having an online class, unfortunately. But this difficult decision has to be made because the safety and the health of our students is the utmost important aspect we need to consider. So we develop better, or we improve from our previous semester. We know that we abruptly shift from the offline classes face-to-face meeting abruptly shift into the online meeting, and it is very uncomfortable for students and also for the teacher as well, for the lecturer as well. But for the next semester, during this summer, all of the lecturers are getting the training to deliver in more in better way of how to deliver the online classes for the students, so that the students do not get frustrated, and also the teacher as well not getting frustrated how the teaching materials are not delivered as the teacher wanted to be, or as effective as the face-to-face meeting. About the possibility of the increasing of the confirmed cases whenever we implement the new normal life. Well, there's always possibility of the increasing cases if we are not disciplined enough to maintain our social distance or physical distance to each other. And we know that campus, it's difficult for us to arrange a campus setting which has safe physical distance. You know, our studio is packed. You know, our class is packed. So we need to consider, with the consideration of the healthy and safety of our students, we have to shift some of our curriculum so that it is delivered online. So the studio will be delivered, or studio or practicum will be delivered in the semester after, or after January. So the possibility of the COVID-19 spread hopefully already subside. That's the hint I can give to my students. I know that it's not been discussed publicly yet in our group, but I think that's the hint I have from the discussion from the decision makers in our university. I hope that answered the question, Reno. I miss you, by the way. I miss my students here. Thank you very much for participating.
Thank you so much. So thank you so much, Reno, for the, I think it's really good question regarding the application of new normal. So everyone has to change, right, by Ilham. So I don't see any question, any other question. You still can post your question first. So I would like to invite maybe Bas Ratios, if you want to post any question regarding the presentation, the spatial analysis or the input, please.
Oh, well, I enjoyed the presentation, but of course I don't have any questions, but what it occurred to me is that it is indeed still increasing there. It is not decreasing anywhere yet. Is that correct? The COVID-19 is still increasing in Indonesia.
Yes. In general, in the national number, yes. But I don't know in the more detail. Maybe Mbak Ilham, you know more?
The level Indonesia is still in the high. Like, we are not having a slow down rate of infection yet. Like for the past week, we have more than 1,000 number of new cases every day throughout the nation. That's very sad to hear. But in my city, particularly, in my city and my province, I think the local government has done a good job in terms of slowing down the rate of infection. We are the most populated city, the most populated province, maybe the second most populated city in Indonesia. But in terms of the rate of infection, in terms of the number of new cases every day, we maintain at the number of 30 and 40 a day. So I think that's the best thing that we can do, and we try to improve that. Right? It's sad to see how the number of cases in other provinces keep on the high, keep rising, such as in Jakarta and in Surabaya, East Java. We have our friend from East Java, Mas Tony Widianto over there. Maybe he can also make a comment regarding to how the number of cases in Surabaya, in East Java, and how the number of cases is not homogeneous. It's not the same throughout the district. So we have district which has 0 or which have only 1 or 2 infection per day, but nationwide we still have like 100 new cases.
In Jakarta, it's not from local transmission. It's most of them is from international flight. I mean, person who is from abroad, they came back to Indonesia. For example, the student who finished their study or everything and come back to Indonesia, or their employer in outside of Indonesia and they come back. So if in Jakarta actually it's relatively stable and actually it's decreasing, that's why it's losing up the restriction. So most of them is from international flight. I mean international from outside, not local transmission. If East Java, I think I don't know if East Java, so I just make confirmation about Jakarta. Thank you.
Thank you, Mbak Novi, for the confirmation.
Thank you, Mbak Novi. So, any other comment, Bas?
Yes. I have a question also. Are the people also recovering? Have you heard of people recovering? And do you count them?
Yes, we do. Maybe we tried to share the previous slides showing the number of people healed from. Here we can see they also visualize the number of people healing. So throughout the time, the upmost graph or line is the cumulative number of confirmed cases. The second line, the red one, are the active cases. So the number of people and minus the people who passed away because of the illness. So this is the part which explains number of people got healed from the virus. Yes, we still have an active cases in approximately 200 something for the whole province, but I believe that it's still considered low in comparison to Jakarta, Surabaya, East Java, and also South Sulawesi currently. Hopefully it gets better. I don't know.
How long does it take for someone to recover?
How long does it take for someone to recover? Maybe somebody can help me.
1 month? 2 weeks? 4 weeks? 6 weeks?
Perhaps 2 weeks.
Yeah,
Not more than 2 weeks. So for first one, they take swab test, and then if it is it is negative, they will have the second chance to test again for at least twice, and then after that they can go out from hospital. I mean, not under treatment anymore. So if I see in the rate of recovery in Indonesia, it is better, I think. I don't know why, but it is better. If I just want to compare, but it is I think a few months ago. If I compare with Netherlands, the rate of recovery of patient in Indonesia is much more higher. For example, perhaps a few months ago, if in Netherlands is still 200 something and the case is more than 30,000, but in Indonesia at that time is around 10,000 or 15,000, but the recovery is about 1,000 persons. So if you see the comparison between these two countries, it doesn't mean I saying that health service in Netherlands is bad. No. I just saying that the comparison for the recovery is in Indonesia is better. Perhaps also we have another influence, like if we have a cold in Netherlands, it takes longer time to recover, right? If in Indonesia you just take 3 days and then you recover, perhaps because of that kind of case, so the recovery rate in Indonesia is higher than in Netherlands.
Thank you, Mbak Novi. So, Bas, any
Yes,
other?
thank you. So that means
Yes?
if I get sick, I need about 2 weeks to recover. Interesting.
If you get sick, you can come to Indonesia and recover faster.
Yes.
I think.
Yeah.
Yeah, I think I just add notes that actually that it's vary between patient between the cases, the recovering time. The longest one that I just read the news last week is they have the longest one, 66 days to recover. The longest one. So I think this is vary, but yeah, roughly that's I think maybe it's a month to recover.
Okay. Thank you, Pak Iwan, for the confirmation.
May I give a remark for the West Java case? If you can see the slide, for West Java, the active cases chart and the number of people healed or cured is almost the same. So I think reading this chart is good news that the active cases and the number of people got healed or cured after contracting the virus is almost similar. So I think it's good news.
The number of infection in Indonesia is not increased much more than Netherlands. If I see case per case, perhaps within this week, Netherlands can be only 100 case, 300 cases per day, and then Indonesia is 1,000. That's why the recovery rate in Netherlands also increased, because in Netherlands has a lot of cases, around 40,000 is since a long time ago, and it's stagnant now. But in Indonesia, it's like it's just the beginning of 40,000. Perhaps only in these 2 weeks is 40,000. That's why the recovery rate between these two countries is almost similar now. You know what I mean?
Okay, thank you all. So, wow, we almost reached 3 p.m. We almost reached the end of the discussion. That's a pity. We still have to make another session of this. I think there are so many participants here want to share also and give you any other input. So I also invite you, all of you guys, maybe Mbak Ilham, you can share also your email address if any one of us here want to send other comments or questions regarding the research, the study. And if there are still people who want to post one question, I will give a floor. So from the team, do you want to post the question before I end the session for question and answer? No other question? Okay, so before we close the session, I want to invite Jorian. Jorian will show, will give us another short tour to ITC building. So maybe some of you are interested to continue your study in the Netherlands, in the ITC. ITC is part of the University of Twente. It's in the border of Netherlands and Germany, so you can cross the two countries in a short period of time. Okay, Jorian, please give me another tour.
Where do you want me to walk? I can maybe show you one of the classrooms first. One moment.
The Rulof there.
No, Roelof is not here. Roland is here. You remember Roland? Look, I just passed him.
Hi.
From the technical
From
service.
Indonesia.
Yeah, he's here helping me because otherwise I was not allowed in the building.
Okay.
Wait, and here, well, instead of Roelof, we have Tom.
Hi.
He's helping now, so or Roelof is there for as well, but today Tom is behind the desk.
Okay.
Of course, the entrance, you all know.
Nice.
Please tell me if I have to go somewhere.
Well, where?
I can show the auditorium maybe.
Yeah.
Yeah, the auditorium, please.
The auditorium, all right.
Yes,
so,
please.
I can maybe do like this.
So while Julian working over there, so IETC is kind of special faculty, right? So before it merged with University of Twente, it's kind of independent faculty institution. So now since 2010, I guess, merged with the University of Twente. So it's specialized in Earth observation and geoinformatics. So for you who are interested in pursue your study regarding the spatial things, please. So this is the auditorium room.
Yeah.
Okay, so this is the room where we usually have the international night, right?
Wisuda.
And also graduation day.
Graduation day.
Classes at the moment, well, of course, now due to COVID, the core modules will be different. But normally, when students start in September, the introduction period is there, and then the first 3 or 4 modules, they're core modules that all students, not depending specialization. So if you're natural resources, urban planning, doesn't matter. All students attend in this room the first core modules, and after those 4 modules, it's spread into specializations into the separate classrooms upstairs. So this is also indeed for the international evening and graduation and all big events.
Yeah, I remember the international evening.
Yeah. Yeah, that's a nice event every year.
Yeah, nice
the
event.
international.
Because Indonesians have to perform.
Yes.
We always do.
With angklung.
Angklung sometimes, tari saman.
Yeah.
Tari saman.
Yeah, in my day we tari piring.
Yeah, nice.
And Julian, how many Indonesian students over there right now at the moment?
We have now currently 12. I just looked it up in the who's who. Currently 12, though I'm not sure if they're all here or that they also do partly in external programs. But there are 12 registered. For next year, I'm not sure, as I cannot access yet the database due to they're not students. I'm not allowed to look into the admitted candidate database. So the new students, I'm not sure. And then it's also depending if flights will go, if new students at the moment will be able to enter. Because of course, if they have their scholarship or their paperwork ready, if there are no flights inbound, they're not able to come. So partly it will be online, maybe we will see. So yeah, is there any other place you want me to go?
Yeah, the front building.
Oh, us the backyard.
The backyard.
The koi pond.
The koi pond.
Sorry.
Actually, I want to see ITC hotel.
It's so far.
ITC hotel. You stayed in ITC hotel during your stay.
Oh my god.
Bang Oi pernah mancing di situ ya?
I'm not fishing, but I just wondering during the snowy days what this fish doing snowy days, that they are not using any food and they keep running inside the pond.
So no, I'm not going inside the pond. Oh, here for the students, you remember these?
Yes.
Yeah, sure.
Nice. Locker.
Locker.
Indeed.
Okay.
Oh well, the staircase, of course.
Okay.
I have to put it like this, maybe.
This building will be missed a lot.
Yes, well, there are plans for us to go to the campus. They already decided on a spot, and a new building will be built.
Yeah.
So we will have to leave this building.
Oh, really?
In due time. Second floor. So,
Coffee machine. Free coffee time.
Again, the free coffee machine. So is it still free?
Yes.
During certain time? Okay, that's great.
Oh
That's
my
great.
god.
Oh my god.
That's 18 years ago. 18 years.
Can we use our old card? Can we use our old card?
No.
the third floor.
No, I think that's enough. Thank you, Jaren. I think you have shown us enough. And if other people here want to see more, they maybe have to apply to come there themselves. You also have a refresher or a short course over there offered by the institution, right? That could be another opportunity for you or all of you who have called to deepen your knowledge in geoinformatics or spatial science.
I think this is the last week of NEDtalk to apply for a scholarship for next year.
Oh, okay. This week is the last.
Check on the Orange Scholarship website. I think the deadline is 30th, so next week, to apply for a scholarship for the academic year 2021.
Okay, good information. So if
you still have
Orange,
short course or
we always do.
Yes, you always do. Yes. So what is the website again? Orange Tulip
Scholarship program.
Orange.
I'll put it in the chat.
Okay, thank you. We'll wait for that. So thank you, Jorian, for the another tour. Thank you. It helps us a lot. It's really fit our longing to the campus. So yeah, I also received another comment from Lewis Anggi. Yeah, thank you for the tour. The building looks stunning. I hope someday I can strolling around there as a student. Yeah, go for it, Lewis. So also, I think I also have another comment that I forgot that I missed to read from Mbak Ilham. Okay, so it's from Mbak Beta Paramita. Can't wait to collaborate more with urban health and well-being research. Great presentation by Ilham. So thank you for the nice comment. So sorry all of you guys, we passed already 3 p.m. but I cannot say anything. It's such a great presentation today and it's such a great discussion, and I'm really happy that all of you have actively participated in this discussion, and I think Mbak Ilham also get a lot of input from today's meeting, right, Mbak Ilham? Thank you. That's such a great presentation, Mbak Ilham.
Thank you, everybody.
Yeah, thank you. Keep on going on your research. So Jorian also post the link for all of you who want to know about the scholarship program for master and also for short courses. Please take a look on the link and go and grab it for it. The deadline is approaching soon, so just take it for the next year, academic year. So okay, so I will end this meeting here before I give it back to Pak Hartanto. So for the closing, I don't have to conclude that the presentation is really great. There are still some things that Mbak Ilham have to further explore, and we have also such a fruitful discussion today. And congratulations for Mbak Ilham for the great presentation. Yeah, I have a little bit announcement to all of you. So next week we will have Bas. Bas will present next week. So I invite all of you here to come again next week. So we will have the presenter from ITC, and Bas already here with us. You will present your presentation next week, right, Bas? So yeah, Bas is the one of the developer of Ilwis. So for you who are working usually with spatial analysis, so Bas is the one of the developer of the software. So next week he will present. So come and invite all your colleagues, all your friends. But you have to come first because we have limited seat. We only have 100 quota for this meeting. So just come and we can discuss furthermore. And also, it's a hot topic right now, right? And I really helpful. Thank you for Mbak Ilham and all of you who are joining us in this net meeting. So I will end my duty here. Thank you for all your consideration, all your attention. I will give this back to Pak Hartanto. Please.
Thank you very much, Mbak Winida. Thank you, Mbak Ilham, also Yurien and Bas Retsios. This is my first time to see Bas Retsios. Even since last year, we have many discussion about Ilwis. Thank you, everyone, for visiting us. Don't forget to come again next week with the same ID, the same password. Okay, everybody. I will close the room and see you next week.
Yurien, thank you very much. Thank you well for the building.
Thank you, Jorin.
Thank you, Jurian. Thank you, Bas.
Thank you,
Thank you, Mbak Ilham.
Coming to this meeting this afternoon.